want to say welcome. Welcome to this space. We know that there is a lot going on in the world across many countries and communities. But today, we are really holding trans people across the diaspora, across the world, centered in our hearts. And we're here today to hear from Black trans women and Black trans men who are at the front lines of responding to the pandemic we know as COVID-19. As Black trans people, we have always navigated unmet needs, and now there's additional new layers that can often go unmet in the course of larger efforts to address the pandemic. And so we really wanted to use this moment to really lean in and listen to the leadership of Black trans women and Black trans femmes, particularly with the release of the Trans Agenda for Liberation's first pillar, the first pillar being titled Black trans women and Black trans femmes, leading and living fiercely. And so today we've gathered a panel of Black trans women and Black trans femmes who are doing just that, living and leading fiercely. And so I'd like to introduce to y'all the panel for today. I'm joined by Ms. Janetta Johnson, representing San Francisco and also Tampa, Florida. I'm joined by LaSaia from Chicago, representing Brave Space Alliance. I'm joined by Tiara Gendi, representing DC, as well as Mariah Moore, our own program assistant at TLC, representing Florida. And so what we'll do is we'll hear from these panelists for a little bit. They'll share some of the work that they're doing, the concerns that are coming up for them. And then what we'll do is open it up to you all for a Q&A session where you'll be able to ask some questions. But before we get into our panel, I just want to take a moment to honor some of our trans sisters that we recently lost. In Charlotte, North Carolina, we lost a young trans woman named Monica Diamond. And so I just wanted to take a moment to honor her legacy. If we could just take a minute. Okay. Thank you for taking this moment to honor her. So, to start off our panel, I really just want to get a lay of how folks are doing. We know that the personal is political. We know that our individual experiences are part of a pattern that links us all together. Basically, if you hurt, I'm hurt, we all hurt. So let's just start by asking all of the panelists, starting with Ms. Janetta, how are you? What does your life look like before Corona compared to now? How are you adjusting?
Good day. Yeah, for me, it's very difficult, and I'm just like being a 54-year-old Black trans woman and experiencing various epidemics and pandemics and all these things that happens that that causes pain and trauma and isolation for communities. It just really it saddens me, but I feel like I have to go back and relive all these different things. And it's always been my theory that if there was ever a national disaster that happened, the Black trans people will be the last to be served. And I've always
Ms.
felt
Janetta?
that. I've always experienced that.
Ms. Janetta, could you turn on your camera, please?
Okay.
Thank you.
Okay, I've always felt that and I've always experienced that. So it's been very tearful for me. I have my moments where I feel like I have to cry, and I'm pretty good at like scheduling time out to cry sometimes, but it's just like the last few days, especially after like really meeting with many community members that are currently living on the street and that are marginally housed. It's scary, it's sad, it's hurtful, and yeah. Also, here in San Francisco, we have been just doing the best that we can to provide supplies to the trans community that are currently living on the street. We've been sort of kind of like doing the best that we can to find some type of housing structure that people can live in. And it's really screwed up because it's just like we've managed to support people in getting housing in some ways, or even just getting into safe places temporarily, like hotels. And it's just like, why does it take this pandemic for this to happen, for us to like really be intentional and pushing and working hard to make these things happen other than our everyday normal work life without the pandemic? And it's just very, I spend a lot of time thinking, processing, trying to figure out how to be as creative as we possibly can, to create whatever opportunity to just support people in gaining access to things that they need. And it's very scary because I don't feel like the trans community, well, in some aspects, we've gotten some response and support, but it's just, we need more. And we're sort of kind of like tired of receiving the scraps and the change in order for us to survive and for our existence. And it's just really hard for us over here at TGIJP. You know, some of my staff has compromised immune systems. I mean, even from the fact that asthma or, you know, family member that works in healthcare facilities that cannot, like, it's a higher risk level. So it's just been a few of us on the front line going out and checking in on girls who are currently doing sex work and survival sex work. And because I have no other option to earn money, and it's like the money is not going through there. And I'm also concerned about the girls that are coming out of prison, like what kind of resources will we have for them? Specifically, coming home to a place that does not really sociably accept transgender people. And then we have this pandemic that people are coming, you know, home to, and where are the resources to be intentional about making sure that when people come out of jail and prisons and locked facilities and, you know, coming out of hospitals and treatment programs at various places, that we are like not having the resources to make sure that they're okay and safe. And, you know, I particularly think about Black trans women coming out of prison. I don't know too many Black trans women that has not been physically, sexually, emotionally, psychologically assaulted. And then they have to come out with the fear and anxiety on top of the fear and anxiety that they already experienced in there around the COVID thing and around like just coming out. And we were waiting on one lady to come, and we were like, okay, when she comes out, you give her this bag. And we put together some kits with the mask, sanitizer, and it's just like we were saying, oh, I want to get her flowers, but then we were like, oh, we need to make sure she gets masked, ... you know? And just not really experience a lot of anti-Blackness that I feel that is happening here. And yeah.
Thank you so much, Janetta. LaSaia, same question. How are you?
Hey folks, and for a second, we're going to pause to switch ASL interpreters.
All right, are we ready? Okay. Hey everyone, my name is LaSaia. I am the Executive Director and founder of Brave Space Alliance. We're doing the best we can at the moment. I just want to be very intentional around the language we use and the work that we're doing. In these particular types of crises, I believe Black trans people, especially Black trans femme and women, have always been on the front line, making sure that everyone else is okay during this particular type of work, even supporting if we're not at the front lines, right? Before, we were still struggling. We were still trying to get a placement with BSA in particular spaces, and doing the particular work that we've been doing. Since this particular type of crisis, this pandemic that has taken hold, we are the only LGBT community center on the south and west side that is still open. Also, other than the north side as well, that is really dedicated to making sure community is fed. Luckily, I have a partner that had brought up this idea of making sure we bring a food a crisis. We can make sure that we're still serving the populations that we're serving and no one is actually left behind. We've noticed that it's 3 particular line items that Black, trans, and gender-non-conforming people are less likely to have, and that's housing, food, and lack of income because most do, right? So in these particular type of climate, we have to we have to do what we can do. Just not only to keep ourselves safe, but also keeping staff safe and also keeping the people that we serve safe at the same time. So the food crisis pantry came into play. We organized making sure we have enough volunteers delivering food on the south and west side and also north side as well. We served this past week over 250 people, and we're starting a new list for next week so we can serve them as well to make sure we don't leave no one behind. In this particular pandemic, we now have over 300 volunteers because they are now noticing the work that we do. I think due to the fact that Obama shared the work that we have, we're getting that Obama effect, good and bad, of like good volunteers, and people are now noticing the work that we do in a particular light, in a particular way. We just don't serve the trans population, but we also serve the population to the LGBT population, right? And then we also bridge the gap in the LGBT population, bridge the gap with the LGBT population to the straight population as well. So we try to make sure that the expanding community understand that we serve all, but center the voices of Black and brown, trans, and gender-non-conforming people. And in this particular pandemic, I'm pretty much proud to be a Chicagoan in this particular climate, because how we're noticing individualism itself will be a killer of all of us, and understanding that we're moving away from the acknowledgement of individualism into we're all connected in a particular way. And if we do not do this particular work, we will die because we're so intertwined. we have to do community work, right? We have to learn that if I don't protect my neighbor, I can't protect myself. So I'm proud of Chicago. I'm proud of how strong the organizers and the activists here are hitting the ground. I'm also proud that they're pushing the work BSA has been doing into a different type of light and acknowledgement of the work that we've been doing. So yeah, I am ecstatic to see what the future holds, but also saddened to know in this particular pandemic, we have to realize the reality of this particular virus that we're dealing with. We might lose a few people, and we won't know until after this pandemic. So yeah, that's how I'm doing.
Thank you, LaSaia. I agree. If we don't protect each other and see each other as each other's neighbors, then who's going to protect us? We still haven't heard from Tiara and Mariah. Tiara, would you like to tell us how you're doing?
Hey everyone, this is Tiara sharing pronouns. I'm a steering committee member with BLMP, and I've been doing okay. I think to answer the questions asked earlier, I want to say how was my life before COVID. I think my life was pretty mobile, and as most people know that we were also scheduled to do a few things at BTEC this year. So like a lot of that work trying to organize and create programs for us to be able to hold community space within the conference was what we were doing until COVID came and slowed us down in our tricks. So we had to change a lot of that work from in-person workshops to digital workshops, which is something we're still working on. And I think that's how my life has pretty much been impacted personally, and also like everybody else, limited movement on where you can go and what you can do. And in terms of the work and community that we work with as BLMP, we're not a direct service provider. What we've been doing is we've been communicating with our communities through emails and text messages and checking up on each other. Because what we've managed to do as BLMP as well is we've created chapters in different cities, and those chapters have people who sort of lead the work and stay in contact with their local communities. So what we've been doing is making sure that our communities are connected to those people and checking in to share their needs that they have. And if we can be able to facilitate and connect them to those needs, that's what we've been doing. And also we've been also working with a few Black trans women who are in immigration prisons, or some people like to call it detention centers, who are also just like going through the fear of not knowing what's happening around them, as they're seeing people being moved out of their cells because they are sick, but nobody has communicated to them to say what's really happening. So there's that fear and that panic of saying they've been exposed to the coronavirus without me knowing, and we already know the problem that comes with the immigration prisons, with not allowing people to have adequate access to their healthcare. So we've been trying to also communicate to keep in touch with those people and making sure that they have what they need while they're still in those facilities, and while we're still trying to fight and make sure that people get released from these prisons that they're being caged in. So that's the work that we've been doing so far.
Thank you so much, Tiara, for your fight for Black cages. I really appreciate the work that all of you do, because it touches on so many of the communities that we work with that are often overlooked, particularly in moments like this. And Mariah, last but not least, how are you doing? Oh, and we can't hear you, you're muted.
Oh, I'm sorry. Thank you, Mickey. I'm doing okay. My name is Mariah Moore. I work at the Transgender Law Center. Under the circumstances, I'm holding up pretty well. Community is underserved, obviously, as many of my sisters and siblings have previously stated. In New Orleans specifically, we're leading the nation in new COVID cases, and it's just really disturbing. And, we have a limited capacity when it comes to hospitals here, our trans folks, our gender nonconforming siblings, all of those folks who may be engaged in sex work or living with HIV or live in rural areas in Louisiana are what we consider our most at-risk populations of folks. Because like Ms. Janetta said earlier, we're often not served at all or given the scraps of whatever was given initially. And so one of the things that happened in New Orleans immediately, and I have to give a huge shout out to Milan Sherry and Dylan Lagerstack, is that they created the TGNC fund for folks who were in immediate need. And we immediately started fundraising and were able to distribute over $4,000 as of today to folks who really, really need it. Also, one of the other things that we were doing is we put together a grab-and-go lunch program. And we've only been able to do one round of it, but we served over 100 walk-in folks and delivered over 60 or 75 meals. And so that was a beautiful thing to serve our people, to serve our community, to let our folks know that we're willing to stand in the gap for them and, just really be there for one another. I think that it hits so close to home when we speak about the pandemic, about this world crisis that's going on, is because a lot of folks who are in New Orleans, specifically our trans brothers and sisters and siblings, went through Hurricane Katrina. And so this is more of a re-traumatization of what happened to us 14 years ago. And so just thinking about all of that and thinking about our siblings and our community that struggle with their mental health, and already in the South, we don't have enough mental health resources and outlets to express ourselves. It's troubling. And so when we're trying to reach those folks, we're all in this community together and doing what we've always done, holding each other down, but it's becoming a little bit unbearable to do it all on our own. And so, we're asking folks, we're asking, our lawmakers at the state level, our lawmakers on the national level, to really take a look at what has been going on. And I think that me and Mickey talked about this, I think a couple of days ago, is like, this is a perfect example of how all of these systems have failed us. Always have failed us. And so I hope that moving forward with this, it'll be a way that we reform all of these systems and that we don't go back to the old tired ways in which we do things that's ultimately costing people their lives. And so for me here in New Orleans, it's just me getting out every day, doing what I can for people. I'm just so grateful that I'm in a position where I haven't lost income. I'm not at risk for losing housing. And sometimes it makes me feel a little bit guilty that I am, safe, and I do have safety and comfort. And there's so many things that I want to do for my community, but unfortunately, we just don't have the resources. As of yesterday evening, the Greater New Orleans Foundation reached out and they wanted to donate $5,000 to the cause for meals and deliverables of hygiene products to help pay phone bills. That's just something we're grateful for, but it shouldn't take a pandemic for you all to be doing that. And I think that's, some of the ways in which I express my frustration to them is that, we've been asking for resources and help for folks who just don't have it. And so right now, we're just trying to keep each other afloat, keep each other safe. And yeah, that's how I'm doing.
Thank you so much, Mariah. I completely understand and agree with you. I also hold some survivor's guilt in this, and just want to say that I feel you on that. And I think the thing that folks who have income, are stably housed, can do in this moment is to support folks who don't have those resources, who don't have that stability. And that's what we're trying to urge folks to do, is exactly that, to act in the ways that you have, that all of you have.
Hi, Mickey. We will be switching ASL interpreters right now.
Thanks, Anna. So the first pillar of the trans agenda talks about a lot of the issues that y'all have raised up, particularly what you spoke to, Mariah, about how this crisis and the response to this crisis is an example of how these systems, government systems, healthcare systems, how they have really failed us, how they've really cost our people their lives, and that's not okay. And so we can't just go back to business as usual. We can't just go back to what's considered normal. And so what is it then? What is the world that we want to build instead? How can we take this moment and really radicalize our approach to how we provide safety and care for all trans people, particularly Black trans women, Black trans femmes, particularly the ones who are in survival, street sex work, particularly migrants. This is the moment, it feels like, right? Like the moment to act and to be fierce and to be bold and to demand what we actually deserve. And I know that y'all are leading so many efforts around this. And so I'll just open it up, particularly to Miss Janetta and to Tiara, but really anyone who wants to respond. What are just some of the ways that you want to see people shift in their support of Black trans women and Black trans femmes in this moment? Where are the areas of work or communities that people should be directing their resources and support to?
Yeah, I think I would say, talking about echoing the sentiments that my sisters have already said about the system being, consistently failing us. I think for many Black trans migrants who flee their countries of birth, fleeing for their lives and come to this country in the hope of seeking refuge and finding a safe haven and living a life that is not targeted. The system already fails us as soon as we get here, right? Because you find so many Black LGBTQ folks ending up in immigration prisons for an amount of time that is not very certain how long you can be there. And if you're not somebody who's connected to organizations, or if you're somebody who don't know how to reach out to people and ask for that sort of help that you need and find community, while you're in there, you can be in there for as long as possible without any assistance, right? So that's already a system that keeps on failing us, as others have said before. To say we are coming here trying to find solace in this country as it is marketed to us. America is marketed to us across the world as the place where human rights are very much celebrated and you can be yourself. But then when you get here, fleeing for your life, you get here and then you still find yourself being persecuted and criminalized again for even seeking something as basic as being safe and protection, right? So with all these people that are in these immigration prisons and not much access to the assistance that they need, be it with immigration lawyers, the money that they need in their books to get the basics that they need, I think the way community can show up in this moment is to direct huge amounts of efforts into that, and that can look differently. It could be in how people provide funds for people who are in there so they can get the things that they need, or it could be just for people supporting organizations like TLC and BLMP when we are advocating and protesting to say the conditions of Black LGBTQ people who are in immigration detention centers are not even conducive for anybody to be living in there. People are being degraded in there. People are being abused and raped on so many levels, and there's just no address to all those things. At least there's no immediate address to all those things. So I would really like to see in this time of this pandemic, like Mariah said, it's really sad to see that people are now showing up because of the pandemic, when we've been talking and time and again to say, these are our needs, this is how we're being violated, and nobody wants to listen to that. But now that we're in this pandemic, it seems like people are now beginning to pay attention and say, how can I plug in? So that's something that I would like to see people plug into and support all the works that people are doing right now to make sure that in this pandemic, we're still creating safe spaces for our communities. We're still showing up to meet all the needs of our communities, even with limited resources that we are working with. We've already proven that we've been doing this work with very, very much limited resources. And we can just only imagine at this point how much more we can do, how much more we can show up for our communities if we have enough to meet those, to address those needs. So that's something that I would really, really want people to show up in. And another concern that is also happening in immigration detention centers is that people don't have, like for us people who are outside, we're privileged enough, or at least we have the movement to go and find specific things that are being talked about, like hand sanitizers, masks, and gloves. But for people who are in these conditions, they don't have the mobility to go and get those things. They don't even have the resources to go and get these things. So they're just constantly having to be moving around within each other in those cells. And there's no healthcare to assess if anybody has the virus or no. So it's just like people constantly being in fear of like not knowing what the next person has. And even if they know, they still have no way to get out or to move themselves away from that situation and put themselves in a place where they can be safe. So I would really want to see people show up in also advocating to say in times like this, nobody should be caged in any form of prison or detention center. I really want us to push that message and get behind supporting that.
Thank you, Tiara. I'm so glad you said that. I'm so glad you said that because honestly, in this moment, it feels like it needs to be repeated that the role of people, particularly funders, I would say, need to be directing funds to Black trans leaders and Black trans groups, not just organizations that have 501c3 status, but Black trans individuals, right? And directly into their pockets. No questions asked, no strings. Because in this moment, that is one of the things that people need most. And LaSaia named this too. The three things that people need most right now are housing, food, and income. And if we can shift our resources to resource folks who don't have another way of access to them, that's one way that we can actually make an impact. And I want to also make sure that I'm giving space to Ms. Janetta to also answer too.
Thank you, Micky. I was just writing some things down and particularly thinking about being a Black trans woman, leading a Black trans-led organization, primarily serving the Black trans community. And we serve all community that we can serve that comes to our organization. And it's like, I don't share that part of our work very much. I'm very intentional about supporting our organization and making sure that this is a Black trans-led organization and we work with the population of people. And I feel like sometimes here in the city and county of San Francisco, that is not acceptable. And I need to say that we serve, it's like they have an issue with me being unapologetically Black and focusing on Black trans people. Although we work with all population and we do just as wonderful amount of work with all populations, but our work is centered around Black trans people. And I think a lot of people do not understand that and accept that and embrace that and see the need for that. Other cultures get to be their cultures, but when it comes to being a Black trans-led organization, I feel like I face many challenges here, and I feel like a lot of the needs that need to be met by Black trans people, and I think if I use an introduction of like, we serve all transgender people, and which we do, but I don't feel like I have to necessarily announce that. And spending time last night on the track and talking to Black trans women that are currently unhoused and trying to come up with some type of solutions and looking in their eyes and looking in their faces and just the surprise that they give you when they see that somebody that looks like them is there to see them and like really acknowledge that, you know, I see you and I know you're here and I know this is going on and like I'm gonna try to work something out to be of support to you. And it makes my work so much challenging when I have to deal with white supremacy and anti-Blackness and feeling like, you know, sometimes you reach out to certain groups and if they don't reach back, you be like, oh, well, you know, you just distance yourself because sometimes I feel like they want Black trans people to beg, you know, and that really bothers me. And I'm also concerned about what are we gonna do? Like we're temporarily housing people and keeping people safe. And, you know, Black trans people who have been chronically homeless. And after this pandemic or after April 7th, which is supposed to be a date, what are we gonna do after that? How are we gonna serve? Like, you can't pick people up emotionally, psychologically, and then April 7th, put them down, you know, like, as if though this was a show or a stunt, or, you know, it's just like, we have to prepare ourselves to be in a position to give some people something real, like when this crap dies down. And it's like, that's why resources for me are so important for the trans community, particularly like Black trans women, because I've spoke with Black trans women that don't feel like they're ever gonna be housed, and they're not gonna look in another face talking about, oh, there might be housing. If you say there might be housing, they want you to get, because they don't want to hear that might shit. Miss me with that. I'm okay right here where I am, you know? And I've been out there and I've been asking questions and just trying to find out exactly what the landscape is and what people feel. And if this were to happen, would you embrace it? Or, you know, just trying to figure stuff out. And, you know, it's just like my ideal thing that I would like to do this weekend. I targeted 2 trans women that are homeless, and they've been chronically homeless for a while, and I'm so scared, but I'm saying like, okay, I'm gonna make somehow, some way, I'm gonna make sure these ladies get at least 2 weeks in a hotel this week. I don't care how I'm gonna make it happen, I'm gonna make it happen. And I said, I can't wait till I get a chance to call them on their cell phones and say, ladies, check this out. I want y'all to separate all your clothes, get a big garbage, I'm gonna bring big garbage bags and everything you're gonna take with you. And I'm gonna take the garbage bag and I'm gonna take them to the laundry and have the laundry doing. When you move in your little room, you're gonna have a fresh, clean start, you know what I'm saying? And I'm gonna like try to like help them out in that capacity in the hopes of, number one, when these 2 weeks are over, we will have some type of housing opportunity for them, you know. Number two, I want them to, like, their faith to be restored in communities that, you know, things can happen for them different. I have the experience of like being out on the street, you know, substance use, strung out on dope, working through all the hurricanes. I worked through all the hurricanes for about 15 years. I was holding on to the pole. You know what I'm saying? But it was the pain, it was the trauma, it was the shame, it was the abuse that I've experienced through all my years that made me stay out there and just not having faith in humanity or somebody that looks like me and really understands me, and not just say they understand, but have went through the same trauma and have overcome. It's like, I feel like I spent so many years wishing that could happen to me. And I had my family, I had my siblings. I mean, they didn't quite understand me, but their doors were always open for me. But the respect was not there as a trans person and as a Black trans woman, you know. So it's just like, I want something really creative to come up out of this opportunity to really help trans people get on their feet and get stable and established and get an opportunity to find safe opportunities to work through the trauma that they need to work through. I seen a Black trans woman the other day getting into a fight with some guy that had violated her in some way, and I was thoroughly convinced, and this lady is not housed either, but I was thoroughly convinced that the anger that she had was from, you know, 1989, 1990, 1991, up until today, of all the people that have violated her, mistreated her, disrespected her. You could just see all that anger from the past. It's like her whole demeanor was like, you will not violate me today. You will not hurt me today. And it's just like, and also, you know, you got to think about the element of, you know, they love arresting Black people, trans people, brown, you know, so it's a lot that I feel like I'm holding right now. And I don't feel like I really have the venue to talk about it, because I'm not going to talk about it with no fake ass motherfucker. You got to be real as fuck. And, you know, you got to have some life experience and some background to understand. And you got to have some real, like, helping others overcome some shit like that.
Thank you so much, Ms. Janetta. Let's just hold that, because that was powerful. Thank you. So with the time that we have left together, I'd like us to talk a little bit more about some of the things you raised, Ms. Janetta, which at the core, it seems like it is anti-Blackness, and how that is showing up in this time, because that is what's at the core of a lot of these responses. And a lot of the grief that we're holding is because of the fallout from folks not listening to and censoring the needs of Black folks in time, Black trans folks. And then to move us out of that energy, even though it is our righteous anger, and it is very appropriate for this time when you just want to scream, I want to lead us through an exercise in breathing into our dignity, and then from there we'll close. So I'll put the question out there for the panelists. How else is anti-Blackness showing up and creating barriers to your life personally and your organizing? How is it showing up in your community? And we'll just leave folks with these examples.
Can I take that question on first?
Yes, ma'am.
All right, so there's different levels of anti-Blackness. We don't normally want to say like, oh, all of it's combined together, it actually isn't, right? We don't normally talk about the anti-Blackness within our own communities, and we don't normally talk about anti-Blackness with other POC communities a lot of the time. Most of the work that we've been dealing with is, and the pushback we've been dealing with is anti-Blackness within our own community, of letting them know, of trusting. And I love when Janetta, I call her Auntie Janetta, have brung it up around the struggle on the ground, around the struggle that we have to do and we continue to do, and actually believing and trusting. And it is, and I use the word trust because a lot of people do not trust Black trans women in leading. And that is the holy grail of what's really behind us actually jumping over that last barrel of you not really trusting me to actually, because of all the things that you hold against my Blackness, me be it trans, me be it a woman, me be it they and them, me being a big body person. It's all beholding of not trusting my Blackness. And I have to go in a lot of spaces, not only as a Black woman, but also a Black trans woman, a Black queer trans woman, and then an educated Black trans woman, as letting them know that not only do I know how to do this work, I have the education to do this work, and I can hold this space and hold it heavy in this space. And a lot of people will give me a pushback of like, you think you know it all, and I think it's a heavy thing dealing with other Black people of like, oh, you think you know everything just because you got an education, or you hold these particular type of degrees, or these particular type of nuances or intersections that I hold. You want to give me that pushback because you think you know what is actually happening behind the scenes. And the heavy thing about this particular type of weight we hold is, how do I break this language down to the communities that I serve that really think they already know best when they don't know exactly what's happening? So the full pushback that we get at BSA is like, who are you as a Black trans woman to show me what I need to do when I taught you how to dress? Or I am the one to protect you, when we don't need to be protected. We actually need to be protecting each other. And I don't need you to uphold me because I can uphold myself as a woman, as a person, with these particular type of intersections that I have. And it's giving a long-winded, continuous conversation of, I'm just not this educated person. I'm still Jenny from the block. I'm still that person that used to hit the hood, so the corners. I used to be that person. I just had to level myself up to be able to bring the master's tools and change them tools so you can have them tools and be able to navigate this system the way you need to navigate this system. And that's the whole aspect of like, how do I continue to do this work and gain the trust in my community when my community don't trust me as a Black trans woman, or just the internalized sexism that we automatically have to face when we're in these positions of power. So it's a lot of doors we have to run through. It's a lot of nuances that we have to break down. And also it's a lot of definitions around the intersections that we hold, right? Because we're just not holding the transness. We got to hold this sexism that we possibly get, especially if you're passable, you hold this particular type of privilege. We have to hold this education privilege in a particular type of light, in a particular type of way. that making sure people that do not have this education are comfortable around us to continue to have the conversation of what they need. But also a lot of the times when we are battling bigger organizations, they're not trusting us because who are you again? And most of these organizations are white-led or cis-white-led, and most of the times that happens. But I really want to bring in the conversation around, I'm receiving these resources to give to my Black community, and I got this education and this organizing to support and help my Black community to move us to the next level. So how do I change that non-trust into trust because of the harm that you have received, but I'm not that person that gave you that particular type of harm. So yeah, it's generational. It's going to take a lot of healing. It's going to take a lot of pushback, but I'm here to de-chain you one chain at a time, and I refuse for you to be left behind, because if I don't take a chain off of you, I don't take a chain off of myself, and we need to realize that. So that's all I have to say.
Thank you so much, LaSaia, for that word. We needed to hear it. I hope that y'all watching got inspiration from that and got your marching orders from that as well of what to do in the moment. That's as much time as we have right now. So I wanted to leave y'all with a couple words, just so that you know that there's a history, a long, deep legacy of Black trans resilience that lives in the DNA of every Black trans woman and Black trans man who is alive today. We have survived contagion and colonization. We have done this before and we can do it again. And as people, we just have to take this one day at a time. But as a movement, we have to really look towards the future, our immediate future, the future we can't even see, probably won't even experience, but we need to work towards that future. And that future is not what we used to have, because we cannot and should not go back to business as usual. That is a future much like this one, present, where we are just fighting for the humanity of our community and fighting to really shift the value of Black trans lives as essential in a time when a lot of services for trans people are being deemed non-essential. This is the time to push for what we actually deserve. So 3 things that you can do are supporting the leadership of some of the Black trans femmes, Black trans women that you've seen on this call, that are also in your life, in your community, amplifying fundraisers fundraisers for resources and income, and reading and understanding the first pillar of the trans agenda for liberation, because the very first demand for Black trans women and Black trans men is trust on leadership. And so I said I would leave y'all with a practice. And so I know that we're spending a lot of time sitting in front of computers. I am too. So what I want you to do is just take a minute, adjust yourself. You can do this while you're sitting. Just sit straight up with your, imagine there's like a steel rod, right, in your spine that's holding you up. And your chin's up and forward. I just want you to take a deep breath. Take another breath in. And exhale out. Another breath in. Another breath out. And let's continue to bring our attention to our breathing, to remind ourselves when we stop breathing, to get back to breathing, to notice the pace of our breath, to check in with ourselves, to check in with each other, and to remember that, I don't know who said it, but somebody said the breath is the smallest form of resistance. And so just sit with that we are resisting even in just like surviving this moment, right? Everything that our ancestors have been through has led to this moment. We will get through this. We won't do it without each other. We'll do it together. Nothing in nature gets by without the support of other natures, and we are no different than that. Thank you so much to our panelists. Thank you so much to our interpreters. And thank y'all for joining us. We'll share out more information as things develop.